Hi students. Today we're going to talk about chapters 3 and 4 in your patient care book, and Educational Survival Skills is chapter 3. Stress is a really big factor in your life during this program. It can affect you both emotionally and physically. There are demands on your time and your resources, your energy and your emotions, and there are a lot of physical manifestations of this stress in your life. As you found in the summer course, this program is very demanding. There will be new science, knowledge, and concepts, clinical experiences that can be completely new to you, patient and physician interactions, and add to this your normal life demands and stress levels that can go up. You need to find ways to balance school and clinical and friends and family and your work schedule so that this doesn't push you over the top. Some strategies to deal with the stress. You have to keep your eye on the goal and putting yourself first for the next 2 years. Having a conversation with the important people in your life about what they can expect from you while you're in college, and will hopefully alleviate some of the stresses from the start. You'll need to find some balance. Learning how to say no or not right now as caretakers is very hard for us, but you'll need to find a way to make that work for you. There's so many signs of stress, and people respond differently depending on things that they've dealt with in their lives before. Some people eat, some people can't eat, sometimes their hair falls out, and sometimes you get a rash. There can be headaches and irritability, insomnia, anxiety, stomach upset, depression, getting colds over and over again. You really are going to need some tools to help yourself to avoid these issues. You need to recognize the difference between what's an annoyance and what is a stressor. For example, traffic is annoying, or how Blackboard grades your quizzes is annoying. Your friends get to go out, but you have to study, and that can be annoying. So these general hassles that you dwell on will eventually have an effect on your health. But what can you do? You need to recognize what your hassles and stressors are. You need to think and speak positively. Write out a plan to alleviate a stressor. A bad attitude or negative language can spread like a virus. It does nothing to improve a stressful situation but make you and everyone around you feel bad. So try not to spread that kind of bad, negative attitude around. You and your classmates are all in the same situation, and the more positive and supportive you can be of each other, the better off you're going to be in the long run. Planning a schedule and sticking to it will go a long way toward reducing your stressors. Don't be an ostrich and bury your head in the sand, or in Netflix, or in Facebook, or anywhere else you like to procrastinate. You need to be really, really proactive to help yourself. And if the first time you plan your schedule, it just doesn't work for you, it's overzealous, you can revise it and fix it until it actually works for you in your life. Finding your way to balance will look different for all of you, but prioritizing and planning will relieve stress and help you stay healthy. Honing your study skills for maximum benefit will be more effective in learning and actually knowing the material. Memorization is fine to a point, but learning and understanding allows for critical thinking that is required in this field. Studying in shorter sessions and then reviewing the material over a period of time will stick with you much more so than long, crazy cram sessions before an exam. Working in your study groups was going to be really helpful. And I think some of you started that over the summer. It's really, if you can stick with that, that's really going to make a difference in how you learn and how things stay with you. So remember, in this program, you're going to have to study and keep your eye on the goal in the long term. And you're going to have to figure out how to demonstrate what you've learned in your job, in your future. So it's not just for now, it's going to be for always. Chapter 4 is critical thinking and problem-solving strategies. The objectives in this chapter are concepts you'll use throughout your career as a technologist. There are also strengths that will make you a lifelong learner as well as a leader. And as you can see, the technologists that are working with you now were once in your shoes, and eventually you're going to be in their shoes, where you're going to have students and you're going to be teaching them the critical thinking and how to make these decisions and how to solve these problems. So this is something you will carry with you for the rest of your career. All of these objectives are actions that will help you to be a great technologist. Critical thinking: employers will expect high ethical standards and sound professional judgment in any tech that they hire. So take advantage of this time and learning from the technologists that you're working with and see what good examples are. You want to use the knowledge and facts that you learn in class and apply them in the clinical area. Combining the classwork and the clinical experience into an aggregate of understanding will help you learn critical thinking skills necessary in the profession. JCERT standards also include critical thinking, clinical compliance, critical thinking, professionalism, and communication skills. All of these have to be goals of the program based on accreditation requirements. So this is all part of the bigger picture in your career. Problem solving and critical thinking steps. These are the steps that are going to help you learn how to evaluate situations as you're working. You're going to need to learn how to apply these techniques, and one way to do that is talk to your tech or your clinical instructor about the things you see and hear at your site to understand how adaptations have been made or how they determined how things were going to be done, likely based on their experiences, things they've seen and done in the past that work or don't work. This is going to help you learn how to use these steps and put them into action. You're going to learn the critical thinking in the classroom, in the lab, and in your clinical settings. You can see the skills in every aspect of learning in the program. We're going to ask you questions. Why would you do it this way? How could you do it a different way? What might work from another angle or a different perspective? You need to be thinking outside of what the book tells you. Critical thinking in the clinical setting will help you understand and see your ethical responsibilities. What if you note that the person taking the x-ray or the surgical tech setting up for this procedure on this patient's hip is setting up for the wrong side? What do you do? Hopefully you'll stop and say, you know, I think it's the wrong side. You have to recognize when it's you need to step in and say something. It doesn't matter who you are in the room, whether you're the student or the surgeon. Somebody needs to step in and say the right thing and do the right thing at any given time. You have to work as a team in every circumstance to do what is right and best for the patient's health and safety. The bottom line is the patient is the point of the whole thing. The following slides contain some case studies of dilemmas you may encounter. They're there's an assignment in Blackboard for you to evaluate the situation using critical thinking and problem-solving steps to come up with a solution. You can look at page 35 in your book for some guidance, but the questions are, how would you handle this situation? What could have been done to prevent this uncomfortable situation for everyone? And here's another situation. What would you do? How would you handle this? What do you think happens when people talk about patients in a public environment? Is that appropriate? And one more. So I'll look for these in Blackboard, your solutions to these issues and these situations. In conclusion, critical thinking skills are vital, but you need to learn how to evaluate a situation, and you need to practice the skill to get good at it. Watch it in action in a clinical setting and practice it in the lab. This is how you're going to figure it out so it becomes second nature to you in the clinical environment when you're working on your own. All right, that's it for today. I'll see you in class.